This year's meeting for the International ITP Alliance has been, monumental, as it is every time we get to meet. It's really important that we do come together because it's those in-between moments and those opportunities where we really connect, we come up with new ideas, we come up with new programs, and we can really, truly collaborate together. And I think they are sensational.
Welcome to Beyond the Count. I'm founder and CEO of ITP Australia and New Zealand and your host, Danielle Boyle. This is a space created for the ITP community by the ITP community, where we share real stories, expert insights, and everything in between. Whether you're living with immune thrombocytopenia, supporting someone who is, or just curious about what life looks like beyond the bruises and the blood tests, you're in the right place. So whether you're driving, out for a walk, folding the laundry, or just sitting back and tuning in, let's dive in and go beyond the count.
Welcome back to Beyond the Count. Most people living with immune thrombocytopenia know about platelet counts, treatments, specialists, and the regular hospital appointments. But what people don't see is the international network of patient advocates working behind the scenes every single day to improve education, treatment access, awareness, support, and research for all of those people living with ITP. Since 2019, I've had the privilege of representing ITP Australia and New Zealand as a member of the International ITP Alliance, working alongside other patient leaders from right around the globe who all share the same goal: improving the lives of people living with immune thrombocytopenia. Every year we come together to learn from one another, share ideas, collaborate on projects, and support each other in the work that we all do within our own countries. It's one of the most important events on my calendar because it gives us the opportunity to exchange knowledge, celebrate successes, tackle challenges, and ultimately strengthen the support we provide to all of our communities. This year, we gathered in Salt Lake City, Utah, alongside the annual PDSA Patient Conference for the International ITP Alliance Symposium. At this meeting, we were joined by representatives from the United States, Canada, Italy, Croatia, France, Sweden, Finland, Israel, Brazil, Argentina, the UK, Ireland, and the Netherlands. We all came together to discuss patient education, treatment access, the awareness campaigns when we celebrate ITP Awareness Week, patient registries, research initiatives, healthcare engagement, and the future direction of the International ITP Alliance. But this episode isn't really about the meeting. It's about what happens when patient organisations come together from across borders and use their collective voice to create meaningful change for those living with immune thrombocytopenia. Today, you'll hear directly from some of my fellow Alliance members about why this work matters, what we've achieved together, and how patients from around the world benefit from these connections. Let's dive in. One of the most important events on our calendar each year is the Alliance Symposium. On paper, it just looks like a series of meetings, but in reality, it's so much more than that. It's an opportunity to step away from our day-to-day demands of running patient organisations and spend dedicated time learning from one another. Throughout the day, we share updates on what's happening in each of our countries, discuss common challenges, and explore new opportunities. We talk about patient education, treatment access, awareness campaigns, research, and we also talk about the future. And while every country is different, the challenges faced by people living with ITP are often remarkably similar. The more we learn and work together, the stronger we become.
The Alliance in-person meetings are so precious because we continue to build a personal relationship about members, because what makes this alliance strong is sharing and our mutual trust and our work together. But that's only possible if people inside the alliance feel connected, and in-person meetings do really a lot to keep that connection and foster that personal relationship.
For me, in-person alliance meetings are incredibly valuable because In face-to-face meetings, you get to know each other on a deeper level and build trust, strengthen relationships. And those strong personal connections have made our collaboration much more effective. And ultimately, they help us make a greater impact for people living with ITP all around the world. So then you can build together.
Well, it was PDSA's pleasure to have all of the members from the International ITP Alliance here. This has become a tradition for us, and we've become a little family over all of these years. And, it's the incredible work that we're all doing together. I think we all inspire each other, and we just enjoy being with each other. We feed off each other, right? We see how we are empowering and educating patients and supporting them, not only in our respective countries, but really around the world.
One question I sometimes get asked is, what does the International ITP Alliance actually do? And it's a fair question. A lot of the work happens behind the scenes. The Alliance allows patient organisations to share resources, exchange ideas, and learn from each other's successes and challenges. Rather than every country creating something from scratch, we work together. If one organisation develops an awareness campaign, others can adapt it. If someone creates a useful patient resource, that resource can be translated and shared. If an organisation has successfully advocated for treatment access, others can learn from that experience. Many of the organisations represented within the Alliance are volunteer-led. Some are very large and well-established, while others are much smaller. But regardless of size, everyone has something valuable to contribute, and everyone has something valuable to learn.
It has been very interesting to connect with the other Alliance members. We get access to the high-quality educational guides and global survey insights. That's very important. And combining forces with the global network gives us, as a small association, more leverage when negotiating healthcare policies. As a small nations association, that's great because we don't have so much access to do this work.
To see that there are smaller organizations that really have no resources, but then to see the incredible work that they're doing and how larger organizations like in the US and in the UK and how we've been able to support them over the years, and even to see, Danielle, how your organization has grown just in a short period of time. But I think it's collectively, right, the support that you get from the Alliance members that has also inspired you to do the work that you're doing now.
We have learned such a great deal from each another. We work together on joint campaigns. We are able to create much greater impact than we could do individually, I think. And for me, that's really inspiring, and it gives me a lot of confidence for what we can achieve together in the future.
So why does any of this matter if you're living with ITP? Because everything we do ultimately comes back to you, the patient. When organisations collaborate, patients gain access to better information. When organisations share ideas, patients benefit from stronger support programs. When organisations collaborate together, patients benefit from a stronger collective voice, and the louder we scream. Having a global network of patient organisations means there is often people who can point patients in the right direction, connect them with local support, or even help understand healthcare systems in other countries. In a rare disease community, that kind of connection can make an enormous difference. But no matter where you are in the world, you're not navigating ITP alone.
Alliance is a space of sharing, and it's very important for each association to have this space, because ITP is not only one country, it's all over the world, and the needs patients are like the same everywhere. It's very important because when we come back in your city, in your association, we can say everyone what Alliance International work for them.
Okay, as every year, the reminder or the confirmation that the Argentina is not alone And the knowledge I get from listening to the other associations is something that's priceless.
That's really amazing to see how people can leverage what is inside of this community. And also sharing our professional knowledge, especially at the international level, that it has lots of challenges, and finding that way to overcome all these challenges it's truly amazing.
Thanks to our sponsor Takeda for their ongoing support of ITP Australia and New Zealand and our podcast Beyond the Count.
One of my favourite parts of the symposium each year is hearing what organisations have achieved in their own countries. And these achievements aren't measured by the number of meetings we've attended or the documents that we've created. They're measured by the impact they've had on people living with ITP. Whether it's improving treatment access, increasing awareness amongst healthcare professionals, connecting more patients with support, developing educational resources, conducting research, or helping shape healthcare policy, every achievement represents lives improved. And what makes this so powerful is that when one organisation succeeds, the lessons learned are often shared with everybody else. A success in Brazil can help inspire Australia. A win in Italy can help support efforts in New Zealand. An idea from Sweden may be adapted in another part of the world. Every step forward creates momentum for someone somewhere else.
Well, our biggest achievement in the past 12 months has been that we got the ITP medical advisor for our association. We've been looking that for so long.
But the last year, we concentrated in increasing the awareness between physician and medical staff to our existence, so they can tell them about us and send them to us so we can help them. And it made me understand that I can change, that I can do things, and it gives me the power to continue and to develop in this area.
My greatest achievement was that our society succeeded to do a survey, a big survey, about ITP. We learned a lot more of our members' needs. So our society's board had a lot more things that we can do for our members. So that was a great achievement.
I have a lot. But my biggest achievement now in Brazil, since February, we have all the TPOs and the rituximab for free in the public health system for all ages. We have free treatment for all my patients. This is the biggest goal that I achieved in this last 12 months.
Over the years, we achieved one of our main goals, that was to get ITP recognized as a rare disease in Italy. That gave us a benefit to have completely cost-free treatments and care for ITP patients. And I think that that's a big achievement for a group of people that just, wanted to help and now is attending international conferences and partners with industry partners in research and also scientific communities. I think that we've really gone a long way.
There was one other theme that came up repeatedly during a lot of these conversations, and that was community. Running a patient organisation can be incredibly rewarding, but it can also be really challenging. Many of the people you're hearing from today are volunteers, people with jobs, families, responsibilities, and often have their own lived experience with ITP. They choose to do the work because they care, because they want to make a difference. And over time, what starts as a professional collaboration often becomes friendship. Many of us have spent years working together, problem solving together, celebrating wins together, and supporting each other through challenges. It's difficult to explain unless you've experienced it yourself, but somewhere along the way, colleagues become friends, and friends become family.
Well, the International ITP Alliance, which we are proudly part of, means solidarity for us. Mainly, that sense that we can be there for each other and learn from each other. For me, it is also like a battery charger after months of hard work, and coming here and listening to all these other people kind of motivates me and gives me the energy to go on and, aim for more.
Oh, I have a global family. I already feel like, I have a global friends, a global family with my disease. The friendship, all the information we share is truly good information about all the works for ITP in all the countries of Alliance. The people inspire me so much to do my best in my country, and of course to share all my goals, the work and all the projects.
I can only use the word inspiring, and so nice to be with the people around you who also have the ITP and working with it and something where you want to do something with. For me, it's a very valuable strategic network when engaging with the industry, when engaging with the scientific community. In that way, we reach and impact very much more people than we could do alone.
Yeah, it has been an amazing trip, and I'm so glad to be one of the Alliance members, because it's actually have changed my life, and I think it's going to move forward.
Yeah, I refer to International ITP Alliance members as my tribe. It's spending time with people that I don't have to explain the challenges I'm going through, why I'm doing things that I'm doing, why it is important. It gives that peer support that actually we provide to patients. Our little tribe is really...
she's growing though. She's growing. The tribe is definitely growing, and we're always open to more people to join the tribe.
Absolutely.
Yeah. Once you're in, it's hard to get out. As much as we've achieved together, there's still a lot of work ahead. There are patients who still need support. There are countries where awareness can improve. There are treatment access challenges that still need to be addressed. There are opportunities to strengthen the patient voice, and there are new patient organisations still emerging from around the world that can benefit from the knowledge, experience and the support of the International ITP Alliance. One of the discussions we had during the symposium, focused on the future. How do we continue to grow? How do we encourage somebody to start another patient organisation in a country where there is limited support? How do we become more effective? Because ultimately, that's why the Alliance exists, to improve outcomes for patients.
My biggest takeaway from this year's ITP Alliance Symposium is discussions that we had about the future of the Alliance, how supportive all Alliance members are to make this Alliance grow, and that will actually ensure the future of our organization, that we set the good ground with the new board members for our association to get bigger and to have a brighter future.
I wanted that stakeholders recognize the importance of the patient's perspective. And I think our input is increasingly valued, and the International ITP Alliance contribute to that. So I think we should continue doing that, so that more and more physicians, pharmacy, anyone who has something to do with ITP values our opinion as a patient.
Or nothing about us without us, right?
That's right.
Yeah. Exactly.
I always have big dreams, but so I see yourself being joined by other countries and reinforcing the work we do, becoming one single unit and working together for each other. I know this will keep growing and we'll keep doing good things, and this is just the beginning.
As a co-founder, when you first pulled all of this together, did you ever imagine that this would be as amazing and as wonderful as it is today?
Never in my wildest dreams. It's just been absolutely incredible, and really my pleasure and the pride of my life to be able to be involved with PDSA and the Alliance and the ITP communities.
I think this is biggest takeaway for me personally is not just the growth in each of the individual Alliance members and the Alliance member organisations, but the possibilities of the future of the International ITP Alliance, really starting to come to fruition, I think it's monumental. It's going to make some substantial change, not just for today. I think in the next 5-10 years, having an organisation that is strong, that has strength, strategy, direction, we're only getting louder and stronger and more vocal within the ITP ecosystem, whether it be with HCPs, whether it be with industry partners, patients, patient communities, etc. And I'm really excited about the future. When I attended my first International ITP Alliance meeting in 2019, I thought I was attending, just another meeting. But what I didn't realise is that I was joining a family, a global network of people who understood exactly what it meant to live with ITP, care for somebody living with ITP, or dedicate their lives to supporting this community. Today, that network spans continents. It shapes education, it improves support, it influences access to treatment, and it amplifies patient voices. And it reminds people living with ITP that they are part of something much bigger than just themselves. Because when one organisation succeeds, we all learn. When one patient organisation gains access to better treatment, we all move forward. And when we work together, we achieve far more than any of us could ever have done it alone. That's the power of the International ITP Alliance. And that's why we're stronger together. Before we wrap up, here are 5 key takeaways from today's conversation, and a reminder that every patient organisation started with someone deciding to make a difference. Number 1, collaboration allows patient organisations to achieve more than they ever could do alone. By sharing knowledge, resources and experience, we can help accelerate progress and avoid reinventing the wheel. Number 2, everything from patient education and support resources to awareness campaigns, advocacy initiatives and treatment access improvements becomes stronger when organisations work together globally. Number 3, no matter where you live or where you travel, there is always a global network of patient organisations ready to support people living with ITP. Number 4, many of today's patient organisations started with a handful of volunteers, a Facebook group, or simply one person who wanted to help others. Every organisation represented in the International ITP Alliance had to start somewhere. Number 5, there are people around the world working every single day to improve how you live with ITP. And together, we're building a stronger, more connected global community. And finally, if you're listening and thinking that your country or region could benefit from its own patient organisation, I'd encourage you to reach out. Whether it's the International ITP Alliance website at globalITP.org or reaching out to one of our member organisations, we're always here to help share our experience, resources and lessons to help get you started. Because every patient deserves access to information, support and a community that understands what they're going through. A special thank you to all the members of the International ITP Alliance who have contributed to this episode and continue to dedicate their time, expertise and passion to improving the lives of people living with immune thrombocytopenia around the world. This includes Caroline, Barbara, Marilia, Ruben, Inika, Mike, Monica, Mikael, Serge and Heli. And a special thanks to all of the other Alliance members working around the world behind the scenes that weren't able to make it to the meeting in Salt Lake City.
If you're looking for support, connection or information, visit itpanz.org.au. You'll find The Count, our quarterly magazine, patient stories, treatment information sheets, clinical guidelines and a wide range of resources designed to help you and your family feel informed and supported. Most importantly, you'll know that you're not alone. There's a whole community here just waiting for you. If this episode was helpful, please share it with others in the ITP community and leave us a review on your podcast platform. It helps more people find Beyond the Count. We've got more expert conversations, patient stories, and more coming soon. So hit the follow or subscribe button to stay updated. Thanks for listening as we go beyond the count together.